This is Winnie. She is an independent, fun-loving bulldog.
In the past couple of weeks, Winnie has been expressing abnormal behavioral tendencies compared to her everyday nature. Winnie has become overly affectionate on the borderline of clingy, and has even shown a decrease in appetite, where normally food was never an issue.
Winnie's owner decides to take her to see their full-service veterinarian to determine the cause of Winnie's recent behavioral changes. When the vet sees Winnie, she notices that Winnie's nipples have enlarged. Because Winnie is not spayed, she decides to order an ultrasound. When she reviews the ultrasound, she discovers that Winnie is 3 weeks pregnant.
Since a normal gestation period for a bulldog is about 9 weeks, the vet sends Winnie home with instructions of daily walks and a consistent diet. Because Winnie is a brachycephalic dog, the vet informs the owner about the complications that may arise during birth and to be prepared in case of an emergency.
6 weeks later, the big day arrives and Winnie is ready to begin whelping. As she starts to have visible contractions, the owner notices some time has gone by with little birthing progress. Winnie is having dystoxia, which is a difficult birth. She keeps pushing, but the puppies are not coming. Without Winnie straining any longer, her owner quickly takes her back to the vet.
As the veterinary assistant is taking a history from the owner, the veterinary technician takes Winnie back to the clinical area to give her a physical exam and begin the necessary preparations for an emergency cesarean section.
Winnie is given lidocaine as a pre-anesthetic. Once Winnie seems to be sedated, her bladder is expressed. Under a combination of isoflurane and oxygen intubation, Winnie is clipped from the xiphoid process to the pelvic region. Any excess hair is vacuumed off her abdomen and then scrubbed for surgery.
Winnie is positioned for dorsal recumbency and quarter drapes are placed around the intended incision site. As the vet opens the soft tissue pack, she requests extra hemostats for umbilical cord ligation, as well as extra hands ready for assistance, and begins the emergency cesarean section.
With the decision of cesarean section without an ovarian hysterectomy, the vet slowly brings the uterine horn out of the abdomen. She then makes an incision on the ventral aspect of the uterine body. The vet starts to empty out the first horn by squeezing the fetus cranially toward the incision. Once the first puppy is out, the scrub nurse grabs a hemostat for ligating the umbilical cord, then severs it. The first puppy is passed on to a non-sterilized assistant.
As the second puppy is coming out of the uterine horn, the veterinarian technician reports that Winnie's heart rate is slowing down. The vet quickly removes the second puppy from the other uterine horn, ligates the umbilical cord, and again passes the puppy along to a non-sterilized assistant. With Winnie's temperature and heart rate dropping drastically, the vet must quickly turn their attention back to Winnie to stabilize her vitals. Meanwhile, the non-sterilized assistant is having trouble stimulating the newborn. The assistant is consistently rubbing the puppy in a towel, waiting for that first puppy to cry before it is too late. She is hoping the puppy is not stillborn.
The puppy begins breathing, and the vet is able to stabilize Winnie just in time.
The vet chooses an absorbable suture on the uterus and uses warm saline to make sure that the abdominal cavity is not contaminated with uterine contents. The vet then sutures a subcutaneous layer rather than dermal sutures so the newborns will not irritate the sutures when nursing.
The newborns and their mother are separated until they all have completely recovered. While Winnie and her 2 pups are sent home, the vet has a few things to go over for owner compliance. She tells the owner to watch Winnie so that she does not get aggressive towards her pups. The owner should express milk from her nipples to make sure that the puppies are getting sufficient milk. The newborn should be weighed daily. If it seems one of them isn't gaining weight, the owner should supplement with milk replacement. Surgical sites should be inspected as well to make sure the puppies or mother are not irritating them.
3 weeks later, Winnie and her 2 puppies, Buddy and Polly, are doing just fine.
Just stay this little. Oh, darling, don't you ever grow up. Don't you ever grow up. It can stay this simple. I won't let nobody hurt you. Won't let no one break your heart. No one will desert you. Just try